So we appreciate everybody gathering here today. For those folks who are joining us via Zoom, we do have some technical issues going on, so please bear with us. The camera appears to be going in and out for unexplained reasons. So we've got IT support here, so they are working the issue. And minimizing something on the screen. So for those of you who don't know me, I'm Brian Bocek, the Vice Chair for Clinical Affairs and Quality. Myra is out of town enjoying some well-deserved rest. And so I just want to welcome everybody on her behalf to our departmental meeting today. The few ground rules, we just want to remind everybody that the meeting is being recorded. We will have some survey at the end for people to do an evaluation. And please make sure to silence, if you're in the room, silence your phones. We appreciate Michael Cahill and Dr. Jen Caragol for being here today. Michael will be presenting an update and overview of our strategic efforts, strategic plan efforts. And Dr. Caragol will give an introduction of the work behind the dedicated Work Well team, as the team has been actively promoting well-being across DFM. Michael Cahill is our Director of Finance and Administration. Michael began his time with the Department of Family Medicine in December of 2022, bringing with him acute care, emergency care, ambulatory care, surgical services, experience in higher education, strategic planning, finance, and operation experience goes back over 20 years. Michael earned a Master of Science in Health Services Administration from Regis University and has been a certified professional in healthcare quality for over 12 years. Please welcome Michael Cahill.
Thanks, Brian. I think one of these moves something. Really quick, am I good with this microphone or do I need to have something else for Zoom? All right, sounds fair. Thanks. Excuse me. This afternoon, I want to just catch up the department on our ongoing effort to operationalize our strategic plan, what's been working, what hasn't been, and just some highlights around some of that development. And then I'm mostly excited to turn that over then to some folks that have been doing active work related to that, for them to be able to share their outcomes, their learnings, and with the department as well. So, all right, you can't see what I can see. There is some serious behind the scenes efforts taking place here. So I'm hoping I don't disrupt that when I advance a slide here. We'll see. Doesn't look that way. Okay, good. So my apologies to the behind the scenes folks if I do happen to disrupt the AV efforts there. So last time I got to talk to the department on the strategic planning, guys, we had the theme of the roadmap, and we're looking where we had been in the rearview mirror and where we were going as well. So with that, driving forward, excuse me, what have we been doing? So we've had, I think a huge point of success was we had a full day A3 training that incorporated the vast majority of the strategic champions and ELT as well. And this was an important step because it enabled us as a department and as leaders within operationalizing the strategic plan was what's our common language of change within the department. That way, as we were talking with one another, as we were deploying efforts, we had an idea of, okay, when we're talking about current state, what does that mean? When we're talking about the problem definition, what does that mean? When we're looking at root cause and gap analysis, we know what one another is talking about in relation to that. And importantly is by having those steps set in place as a department, it's saying, we know how to problem solve. It's not coming in and saying, do I know what's right for you? Or do I have the solution for you? But rather, what's the problem or opportunity at hand? And how are we going to address that in a concerted methodology that helps us have the highest probability of that the change we put in place will be successful. And if not, hey, now we know how not to do it. So what's next? And so for me, that was a highlight throughout this effort for sure. Integrating the strategies into the budget process this last budget cycle. So a past leader of mine said, you want to know someone's priorities, look at their pocketbook and their calendar. And so by integrating the strategies into our collective pocketbook and the calendar of what's to come in the year, this is saying this is important. These are what we're saying we're funding. These are what we're saying is important going forward. And so by having that integration of what's being asked for in order to be able to execute on that as part of that budget process, again, good win. The implementation of monthly champion check-ins. So, I'm sorry. The process, if I sat on my hands, I wouldn't be able to talk. The process of having those check-ins and for champions, the ability for the champions to learn from one another and also be able to communicate what those advancements are is a huge win in and of itself. And I'll talk to this a little bit further here down the road. Then also, what are dubbed office hours or, the work sessions of being able, little less formalized, but being able to come in and again, just work through, okay, hey, I've tried this, or we're moving in this direction. Where should we go with that? So keeping with the driving theme, there's been some speed bumps along the way, right? Speed bumps, potholes, major catastrophes of road closures. Hasn't been smooth sailing in this. I want to talk to that and acknowledge that. So one of it is making time. All right. So again, calendar and pocketbook is we have again, it's a win by setting in place and surveying our champions to say what times and days work best. And so setting aside those times and days every other month to say, here's where our check-in's going to be, because that was a key piece of the advancement of the strategic plan. It's been tough for folks to find the time to be able to show up to the times that were selected. So the time to do, just for the check-ins, the time of the work, and that goes to the other part of reconciling the priorities. So as a department, we've said that these strategic initiatives are the important parts of growing and sustaining the department. And going back early on of that notion of, I don't have time for this strategic stuff, I've got work to do. And that's still, on the pendulum of where we're leaning. And so this again is the first strategic plan that's been implemented in some time, if not forever, within the department. And so we are, as a department, learning on that as well. And budget, can't hear that enough, right? And it's a real aspect, call it the pothole, call it the destroyed bridge. I'm not quite sure where we're landing yet on that from an analogy standpoint, but it's a key issue to say that has affected the strategic planning deployment process. For example, we had, as you may or may not remember from past presentations, from a structure standpoint, there was going to be a dedicated resource overseeing this from a project management standpoint. And that was deemed through definitions for the dean's office as we can't move forward with that. Combine that with the funds flow effort, for a while there, speaking for myself, because I was playing the part of this project manager, the 1 foot on the pier, 1 foot on the boat in terms of managing the funds flow process, managing the strategic plan for the department. And so all of these coming into play with how we've gotten to where we are with the strategic plan. So, best laid plans of mice and men, right? Is we set forth our course, but we also know that sticking with the theme here, the GPS will be saying recalculating once in a while along this path. And that's where we are, is we still know that these are the important parts of the department, and we're working to say, how do we successfully deploy that? And we're learning the lessons as we're going along and adjusting with that. So I do want to highlight, we are progressing. Just not my slides. There we go. See? Told you. We are progressing, and I want to highlight some of these items here. So 3 of our top 5 prioritized strategies are from the aim, our people. So what are we doing in relation to that? And one of the key aspects is our people is the human resources. And I want to talk to some work that's been done related to that. And so with that is just a brief look of how we have gotten to where we are. And so our former HR manager departed last 2 Marches ago at this point. And so with that came a review of needs to say, what does the department need? Not of the mindset that just because a position becomes vacant, it has to be an automatic refill. So what's necessary to the department? And in interviewing leaders and interviewing the HR team or working with the HR team, we came up with a bit of a modified job description, set that forward, and we got some viable candidates that ultimately we lost to other jobs. And so that first take was a failed search. And so again, looking at what can we do to have a more successful search. And so again, another modification of the job description, a modification of the job search process, try and make it more expedited. And we, again, had a very viable candidate that anyone who wants to listen to me go on a serious tangent as to why we lost that candidate, I'm happy to talk to you when we're not being recorded. So we had a second failed search. So again, is at this point, I'm not looking to have a Sisyphean exercise of let's keep doing that same thing again and again. I want this boulder to come back on me. Others might know it as that definition of insanity. I did not want to play to that. So again, it's what does the department need? And so again, being at this time, we had some time passed from the initial assessment, again, reviewing with the leaders what's needed and how do we accomplish that? And so with that, where are we now? Well, restructured that HR team to in concert with the HR team. So this was a matter of, if you've heard the phrase, not about us without us, is HR with their help of, so this is what the department needs, how do we do this? And so structured that HR team to provide, as it says, that high level of service the department has come to know. And so we brought on 2 new positions for when the manager position brought in two new positions to highlight a specialty of employee relations and organizational development. Again, very much closely tied to the strategic plan priorities as well. And because of not having that centralized figure, there's probably going to be questions of who to go to for what. So no place like a department meeting to highlight that. So get out your pens and papers and be ready to take notes on who to go to for what. So Lydia, yes, woo. Agreed. For recruiting, job posting, staff promotion process, and frankly, who to go to if you don't know who to go to. Lydia is a phenomenal resource for that, and that is that central point of contact. If Lydia happens to be on vacation, come see me. We'll be sure and get you taken care of. Kristen. I'm loving this. All right. And Kristen, and live and in person, annual review process. And darn near everything faculty related. So promotional mentoring, phased retirement agreements, professional liability and malpractice letters, faculty privileging and credentialing. Christina Hobson. So, yes, again, payroll, HR system changes. It's called HCM for the time being. Gosh, know there will be changes to come down the pike on this. But so PETs, reports, any FTE changes, salaries, updates, address updates, all things benefits. So for example, FMLA, family. Family's been fun because even the family department for the campus is still ramping up on that. So there's always questions. And when you have them, Christina is who to go to. And starting with the welcoming, if you haven't met her already, Darla. Yes. So new positions. I just want to highlight, and this is smaller than the first time I presented this. The little circle button here is, it's a key piece of as folks are coming on. I want them to be successful. As a highlight from day one for me is everyone has a right to be successful at what they do when they come to work, and this is no different. So we've been really purposeful in onboarding our new folks and giving space for that. So Darla is being cross-trained on all the HR day-to-day, but Darla was also brought in specifically for her organizational development acumen. So that goes to the leadership development needs within the department. She will be working on in concert with our campus OD team on what works to bring in-house for us. New employee onboarding and orientation, as well as the annual review process. So Darla is already making immense inroads on that. Been very impressive, and so expect to see that hitting the road for feedback here before long. So again, welcome Darla, and then let's welcome Brooke as well. Also, again, that space as formally said, but so Brooke's again cross training on the HR day to day. I want to stop really quick. Just the other key piece that we were looking to address with this is those single points of failure. It's a departmental issue, and we had the ability to address it within HR in this as well. If someone goes on vacation, life doesn't cease for that process. And so by having that cross training within this team, we're creating that ability to always be able to service within the department as we're going along. But Brooke was also brought on for employee relations. So she has a great skill set and as well as the demeanor to address employee relation issues. And as highlighted this morning in a different meeting is sometimes when HR is sought or brought into a situation, it can be seen as a punitive aspect. I want us to move away from that mentality. Our HR department within our department is here to help us, pure and simple. Is if there's an issue, we have the expertise now in-house to help through that. And I want us to take advantage of that. And again, it's not if you seek HR's help, it's to get someone in trouble or that you're looking to get someone in trouble. It's about how do we set ourselves up as a department to be as successful as we can. And again, so welcome Brooke to it. So that's the new look at our HR department. And again, it goes to, among many reasons, is our focus in the department as from a priority standpoint of our people. And it's a matter of it should be showing a demonstrative priority to that. And so, we've got, I also say is we haven't gotten to where we are quickly. So moving out of where we are quickly isn't going to happen either. And so it's going to take purposeful work. It's going to take engagement from all. It's not a light switch. It's not a magic elixir. It's going to be process based, and our everyone involved in that to make these changes that are going to help that continued evolution of the department. So with that, is I'm lucky to get to now turn this over and highlight some efforts that have come out of the strategic planning, specifically work well. And I got to tell you, is the work that's come out of this could easily be a case study to how to execute on these strategic priorities. It'd be really easy to throw a whole lot of stuff at the wall and see what sticks, and maybe through some luck or Hawthorne effect, you might have some minimal effort. But this team has really gone the whole way to say, what's wrong? Where's it wrong? Where are we? Where do we want to be? What can we actually do to get there? And I'm really excited that they get a chance to highlight their work to the department this afternoon as well. So Brian, if you wouldn't mind, we can turn that over. think while you're doing that, I'll find their presentation. There we go.
Thank you, Michael. Huge congrats on all of the hires that we've made, which have been great additions to the department. And so we look forward to having the new group of energy behind supporting our faculty and staff. Our next presenter, Dr. Jennifer Caragol, is a family medicine physician and has over 20 years of experience in the medical field. She graduated from the University Colorado Denver in 2004 and is affiliated with UC Health University of Colorado Hospital. She provides care in a personalized environment and is dedicated to providing quality healthcare to patients. Important to her work is being core faculty for the residency program and the well-being leader for the department in the School of Medicine. And so please welcome her. Yeah. All yours.
My time. Hi, everyone. For everyone on Zoom, I'm sorry you can't see the slides, but we're emailing them to you. And if you have questions, just email me or Carly. We're happy to cover this. So I'm speaking on behalf of me and Carly, but Carly's like a major force in this group. If people don't know Carly Kreisel, she's a good person to get to know. Right? Yes. She's in the back of the room waving. So DFM Work Well is a group that's been put together after the strategic plan was organized to reach this strategy 8.1, promote and support the well-being of all members of the DFM across all sites. So I just want to quickly highlight the tactics that are listed here. So the first is pledge steadfast commitment to the guiding principles of the CU Department of Family Medicine. The next is create and maintain a cohesive departmental community that is inclusive of all locations. And then to establish an infrastructure that is conducive to well-being and professional fulfillment. So this is huge. I think this is really a culture shift across the DFM, a culture of wellness that we're trying to support. And we have a small but strong group working on this that I want to introduce. But I also just want throughout this presentation to continue to invite you all to come to the meetings if you're inclined. And like if you have ideas and if you'd prefer just to email us and tell us your ideas, you know, we are open to all input and would really love to hear from you. The Work Well Committee at this time includes Gil J., Angelo Alago, Chandra Brown-Levy, Danica Buss, Michael, myself, Cheryl Harrington, Carly, Stephanie Mitchell, Anne, she goes by Anne Netterveld, Cleveland, and Lauren. Cleveland and Carly and I set up DFM Well to address this strategy 8.1. And these are all the members of the Work Well Committee. What we're trying to do and how these people, you know, how this like initial core group was developed is we're trying to have members from all aspects of the department. So from all employees. So that includes research faculty, clinicians, behavioral health, and staff. Project Thrive, which is a clinician-specific well-being initiative, has been going on for several years now, but there wasn't anything in place for staff and research faculty that was precise with the full department behind it. So what we're looking for is a much different structure than the one that we had, where each kind of group is on their own, you know, kind of pulling for the win. We're looking to have a well-being culture, you know, a strong community of connected people across the entire department that's pulling for this, if that makes sense. So in the spirit of that, this is a meeting place for people who have very different perspectives and different roles in the department to discuss things, propose initiatives, and work on things. We meet every other month. And again, you are welcome to contact me and Carly if you'd like to attend a meeting to see what it's all about. You are more than welcome to do that. And then it may be in the future, I hope, Carly and I hope, we'll have some initiatives, some specific initiatives, and we can ask for volunteers and see who might be interested in participating in those. But again, we don't think that we can move this forward to the degree that's possible and at the speed that's possible without really hearing what people think, what's working, what's not working. And we're proud of the people that are on that committee because they really do represent the department, which is wonderful. So the DFM Work Well group recognizes that well-being means different things from person to person. Certainly, we came up with a broad definition, but certainly this might vary for you. So just to ground this in the definition that we came up with, I want to bring it up. So the overall quality of an employee's experience and functioning at work. So that's the definition that we're working off of. This includes protection from harm, meaning safety and security, connection and community, meaning social support and belonging, equity and inclusion, so fairness, work-life harmony, including autonomy and flexibility, and then mattering at work, so feeling seen, heard, and understood, dignity and meaning. And then the ability to do our best work, opportunity for growth. So having opportunities for learning and for accomplishing, and then collaboration, I would include that as well. And then organizational team environment. So having resources that we can all look upon, an infrastructure that really supports well-being across the department, and then in time, policies, programs, and practices that support all of this. Does anyone here have any questions about that? Or Zoom, I think you guys can all hear but not see things. Please interrupt me at any time if you have questions. We came up as a group with guiding principles. That's to support well-being without adding large workloads, right? We want to support well-being without making it a project. And then balance personal well-being and collective well-being, recognizing that our personal well-being affects how we arrive at work, how we are at work, how we are with other people, but also wanting to be cared for at work for whatever it is that we're going through. And then recognizing that the well-being of everybody around us is as much adding to the culture and the environment and the experience of working together as a team. And then to meet people where they are at. Understand that well-being means different things to different people. We want to ensure sustainability, consistency, and transparency. We recently just emailed everyone to kind of launch this group email that everyone can get to, the DFM Work Well email. So people are welcome to do that. And then again, for this transparency, we really want to invite people to our meetings. I hope you're not bored to tears. We discuss things for a long time, but I think it's very valuable, and that's the point. And then limit the scope so that work and goals are manageable, but also make note of future goals so they don't get forgotten. Beware of history. We want to move forward. Be a good well-being role model, as well as behaving in a way that you'd like to see the culture shift. And then think about barriers and solutions in terms of personal, cultural, and structural. So these are the things that we keep in mind and have in our back pocket every time we meet. A well-being culture involves all of us, right? So we really need everybody to participate, speak up, act in ways that better our own well-being and the well-being of the folks that we work with, and really come together. And the meeting is one way to do that. I think these departmental meetings is another way to do that. But again, it can happen even in small shifts, just in conversations with the people that we do have the opportunity to touch base with on a regular basis. So a lot has been done for staff. Carly has done an amazing job at moving things forward. There was a staff listening tour that many people have participated in. The Office of Adaptable Resolutions helped us with that here at the School of Medicine. what we wanted to do was to understand the thoughts and experiences regarding staff well-being in the DFM. This was done in February through May. 17 people were interviewed, and there were 19 people who participated in the focus groups. And then the Office of Adaptable Resolutions put together a report that shows the findings and recommendations, and leadership right now is working on how to move that forward. Like, what aspects of that can we move forward? So an example of that is the onboarding. So there were recommendations made about how to onboard people. These were very specific, and these recommendations have been shared with the onboarding work group to help with that. So that's an example. So this gets to all different aspects of the work experience for staff, and this will continue to be a conversation among staff and at staff meetings. And then for research has been doing a couple different things. So the first is community building circles. The community building circles were also done with staff. This is led by a group called Cahill in February and March, with the theme being a time of change and uncertainty. So the Cahill group offers community events and they're willing to set up events for groups. Cahill-led community building circles were done for these two groups, but could be done for the groups again, if the department felt like that would be beneficial. And then also they could be done for clinicians, for example. And people really seem to like this. There's generally centered around a theme. And so again, this theme was time of change and uncertainty. And everyone in the meeting is asked to share. So they share how they're feeling or what they're hearing or what they're experiencing in order to really stimulate the conversation and have the group feel closer. Another thing that the research staff and faculty have been doing is a book club. This is a book that the department purchased that was picked out. It was recommended and picked out by research staff and faculty. They're meeting monthly, and I understand that the book club has been a big hit. We're thinking about offering a book club that's open across the whole department. I don't know, we always have to think, right, how many people, if too many people attend, would it be too much because there wouldn't be enough discussion? Does everyone want to get behind one book? Should there be just a couple different book clubs and then you have book options? So anyway, Carly and I would just love to hear from you on your ideas about that, because this is really an opportunity for us to go forward and to talk and meet one another. Remember that the department is spread across such a large geographical area. So many people are working from home. Many people are working from clinics that aren't nearby, and attending these meetings in that way can really separate us. It took me years to figure out who, different people in the department were, aside from Christina, who emails us monthly, and Kristen, who we depend on for everything related to credentialing. But it can be really difficult to know who one another is. So the idea behind these programs is really to get to know one another and to open up opportunities for connection, because we know that that will change the culture and build community. There was a research community building survey that was recently done, and now people are still have the opportunity to fill that out. So I don't have any data to present on that, but that's making another go around to get more results. And then the research department will be talking about that in more detail. And then from a clinical perspective, we have Project Thrive, and then we have our specific things that we're working on right now, which includes reducing the in-basket burden, because we all feel like our in-baskets can get out of control pretty quickly. Right now, we're operating off of a grant from the School of Medicine in order to put forth 2 protocols, and we're asking clinics to adopt these protocols, and then we're studying how those protocols affect the in-basket volume for providers. So we're just close to the launching point of clinics being able to learn about these protocols. That'll be this month, and then adopt those protocols. And then the research team will follow those results for the remainder of the grant cycle, which is approximately 1 year, to see what the impact of that is. We hope it's really positive. We know that whatever we learn, it'll help with the next steps. For Happy Place, really trying to promote people to have a professional area of fulfillment. So those, we have questions included on the Prism to talk to everybody's supervisors about around what your happy place is and how that happy place can be promoted for you at work, how you can focus some of your time doing that work specifically. And then we're going to get, for planned care on the clinician side, it's been 2 years now. We adopted certain protocols that the MAs can put forward so that providers don't have the task burden of signing things like a point of care A1C, mammogram orders, things like that. And now we're going to look at what the next phase of small protocols like that, small but potent protocols, can be rolled out that can reduce the time burden for the PCPs and other providers when seeing patients. We have a lot of areas for opportunity, and really we're focusing on community building. So connection, that's where the book club comes into place, or these circles, or you might have other ideas. And again, we would love to hear from you. And then really thinking about shifting the culture of wellness through small shifts. We realize that this is going to take time, that we're trying to connect people that may, rarely see each other in person. And so what's something that you could do that would potentially be a small shift in the direction of meeting and knowing more people? So an example would be attending this meeting. This is like a perfect example of that. Or the spring fling, or jumping on the monthly research meeting, like having an opportunity to kind of show up and have the ability to say hi, introduce yourself, and get to know something about one another and support one another's professional endeavors. Does anybody have any questions? This is how we can be contacted. The email is dfm.workwell@cuanschutz.edu. But if you can't remember that, you can just email Carly Kreisel and then me, Jennifer Caragol. Those names will pop up quickly. No questions? Okay.
Thank you. So we'll get another chance to ask questions right now. This was all done under the auspices of strategic planning, and you saw the connection there on the slides. So we would like to see if people have comments, either from the room or online, about some of the information presented today, or about questions and or things that you'd like to see involved in future discussions in these areas, things that you might not know if it was or wasn't covered, but may have some goals for or suggestions for topics that they can pursue in the future. We'll go with in-room questions first. We have a microphone that will be brought to you should you have a question about this topic, either one of the topics. And I'll ask the first question. Michael, I had a question for you. With the strategic plan, there's so many different moving pieces on this and the different elements. What's the best way for faculty and staff to stay aware of what's happening with the strategic plan and any concrete wins or accomplishments?
And that's an absolute, okay. I'm louder in my head. That's an absolute imperative. And so one of the goals for this past fiscal year was to implement a dashboard and a communication strategy related to what the progress is that's being made. And unfortunately, that was one thing that did not get accomplished in the last 12 months due to the aforementioned speed bumps and potholes along the process. And so it's still a to-do related to this, because I want to really be able to show, okay, so if this is where we're saying we want to be in 3 to 5 years, great. That's enormous. Well, what are we going to do for the coming year? Okay, and in this coming year, what are the projects associated with being able to advance those goals, and who ultimately is involved in that, so that we can say, you know, from a line of sight, and that accomplishes a couple things. It's not only who's working on that, but hey, what's my tie to being able to advance this strategic plan? And so it's a key component that is to come, and it's just has not been created yet. And I say just as if it's easy, but that is a piece. And so twofold is, one is being able to capture and return back out who's working on what and where are they, and how's the progress going, but also, you know, that key aspect of how do we put that out there. So for example, in past lives, that was done through flat screens in the facilities. You know, we're out in public and business space saying, hey, here's what we're doing and here's where we are with this. In our environment here, it's trying to adapt that similar notion, because I really don't want it to be a passive delivery, but rather I want it out in front of folks to, you know, really highlight the work and shine a light on the fact that here's the work that's being done, here's who's working on it, and here's where we're going with this. And so I don't want it to be, you know, a passive of, well, if you're interested, you can go find it. But how in our hybrid and geographically diverse department are we able to to keep this in front of folks?
The staff report, the OAR staff report, is that something that is accessible? We're as thinking about building, you know, processes and different things for Campfire, and would love to have those things in mind if they've already been collected.
Are you interested in the report or the process? Like, are you looking for some ideas as to how to do it yourself, or are you just interested in the actual findings?
I think the findings, just if there's things that came out of that we don't want to, you know, either perpetuate if they're bad, but or reinforce if they're good, just to have something to look at.
Yeah, we're in the middle of figuring that out with leadership, the best way to make people aware of that.
That ties in with my question too. And I think, you know, around the communication strategy, because again, thinking about, I'll be honest with you, I'm not fully aware of all the, like the full strategic plan that for the department. So I'm sure it's somewhere, but because, you know, to know how how that interacts and interfaces with a lot of the different programs and different things we have going on within the department, I think would be useful too. So, because I think both of your presentations are so helpful, because it helps me to better conceptualize, like, how do you take the things that are in the strategic plan and then how they're actually kind of applied to what you're doing kind of in your day-to-day work type of thing. And I think as part of that communication plan, I think that would be helpful.
And thanks for bringing that up. And if where it resides for the time being is on our intranet, there's a tab on the left side from the homepage that has strategic plan. Language, unfortunately, has to evolve on it. And it does show at this point, you know, what are the mission, vision, goals, aims, strategies, champions on there. What I'm looking to, again, evolve that to is, okay, well, where are we with that? And what's the work related to and the outcomes? So thank you.
Do we have a call?
All right, we have one question online. They are curious how we will be aligning with UC Health anticipated use of a bridge for clinical note-taking after the pilot. They note that this has been used successfully in other clinical enterprises and can't come soon enough.
I can answer that. So the question is about a bridge. For those people who are not sure what a bridge is, it's emerging technology. It's ambient dictation in the exam room. So that means that there's a listening device that you're aware of, a phone or something in the exam room. And then that transcribes the visit as the provider and the patient are talking with each other, so that the providers don't have to go in after the fact and write a note or dictate or do what they do. And so it makes the work of being a provider much simpler and has been a really big success. It was piloted across multiple departments in a true pilot kind of randomized way. The results show that within primary care and family medicine, made heavy use of a bridge, and that it was really successful in reducing the time it takes to complete documentation. It was used by our APPs, it was used by our physician providers, and it was used by our behavioral health providers. And in all of those groups, it was a success. So successful that some people have said, look, don't even take it, like if you take it away from me, I will pay for it out of my own pocket just to have this available. So that's not the plan. I've been told, I checked on this beginning of last week or into the week before. There is an agreement moving forward to expand a bridge beyond the initial pilot. I believe it's going to be appropriate for both types of phones, and whatever it was working before should work going forward. And the specifics of the agreement as of a week and a half ago weren't negotiated yet, so it wasn't public to share. But we anticipate that there will be a collection of licenses that we are able to ask for and to use. And so within the department, our priority is to make sure that all of our providers have access. There are ways that are being explored in how to use this in a teaching encounter, and I've seen some presentations recently about how to use a bridge device, and Linda gave one yesterday this week. I saw some stuff on how you work with learners and dictation and all of those issues. I know we have our innovation practice, our center field practice, and one of our goals obviously is to get this technology into that practice as one of our highest priorities because it matches with the other things. But we'll have, I've been told that we should have success in our requests for a large swath of providers. And I was told to stop asking questions and that in another 2 weeks, I would hear a better, more official announcement as they work through some of the details. So there you go.
Thanks, Brian. As of now, we have no other questions online. Are there any more in person? Otherwise, for the first time in my 2-year tenure, we might give you time back from the monthly meeting so you can socialize. And thanks for everybody's patience online. All right, well, I just will share one more thing and I will make sure to put it in the DFM download. We do have a front-facing website for the strategic plan. That's a very easy kind of download that you can see everything at a very high level. And then we also have it on our intranet that has, listings of our champions and those types of things. So I'll be sure to share those out in my Friday communication too, just so you can easily see the links. And if you have questions about that content, you can let me know too. Thanks, everybody. I hope you have a great rest of your day.
Thank you, everyone.